Right, thank you so much for staying with us. Just taking a look at some of your feedback here, especially on Twitter. A lot of you saying you're watching Gikonyo Mushiri. This is an ardent fan of Hase and TV47 Weekend Edition. Thank you so much for always tuning in from Kamasharia in Kamune. Asante, yeah? And of course, he's saying he's enjoying the conversation, which he finds insightful, yeah? So, there's so many things that Minnie here, actually Minnie Mururi, who is a mother and digital marketer, and of course Dr. Angela Anzeze, an obstetrician gynecologist. There's so many things you two are saying, and I'm getting so many follow-up questions. For instance, I intended to come back with what she talked about, the wound opening, yeah? But I want to take a pause because I want to go back to the benefits of having a CS, because we're talking about the risks associated with it, the complications that may arise. But you mentioned it takes a shorter time, 1 hour, yeah?
That's the average.
Yes, that's the average.
Longer, or it can take shorter.
But surely there must be some benefits of a CS, yeah? Which are?
So benefits, I would not really call them benefits, but more of, well, benefits in terms of health, yeah. So you reduce the risks on the mother and the baby. If the condition of the baby is at risk, then you deliver the baby at a certain time to prevent those risks or those complications from occurring. So those are one of the benefits.
All right, okay. Yeah. Okay, actually, Doc, that expression on my face is because there's so many questions. Hey, Bernard.
Well, they can reach out to me on Instagram or Facebook, or even come to my clinic at Nelson Awori Center.
Because one is asking, she doesn't give her name, which one is better between normal delivery and CS? I mean,
I can't
really
say
a choice?
I can't say one is better than the other. It just depends on the condition of the mother and the condition of the baby. Yeah.
Most definitely. There's one here that I actually had on my notes here, because mine was, is there a limit to how many CSs a woman can have? And this one here, some designer is asking, how many children can a mother have through C-section?
I can't say there's a specified number. I can't tell you have one and that's it, or have two and that's it, or have three and that's it. What I can tell you, if you're a patient that is undergoing antenatal care, I can tell you the risks associated with having multiple cesarean sections. And so placental issues, your placenta abnormally attaches to the uterus, or is abnormally located in the uterus, and that predisposes you to having complications at delivery. So you may bleed a lot, which is called postpartum hemorrhage. Risks of having a uterine rupture. The scar may give away, especially if you've had multiple cesarean sections and you have labor. Because if you've had multiple cesarean sections, we tell you, come for your CS before labor. Yeah, so we tell you like 39 weeks, for example, before you go through labor. So if you have labor and you have multiple scars, that puts you at risk of having a uterine rupture and bleeding at delivery, which sometimes may be fatal.
All right, okay. There's so many more questions. We shall get to that, and of course I do have my own. But Minnie, there's something you mentioned about what I would call support, emotional support especially, and physical too, from your husband, because you said that you actually left this, was it days-old baby with your hubby to just figure out what to do with her? I mean, how important is such kind of support to mothers, to new mothers?
They really need support. Because for me, I had the best support in the world, because he was there. Even though we were only two, he gave me the best support in this world. He cared for the baby when I couldn't. And that's all what mothers want. Just being assisted around, especially with a baby.
Right.
Yeah.
Okay. I shall come back to you. There's so much we need to do tonight with so little time, okay? Doc, let's talk about, it's a three-tier question, yeah? Because what women should know as you prepare for a CS, that's during the 9 months, yeah? What to expect at the hospital. In my research, I came across preventing blood clots, what you guys do, putting you under anesthesia and all, and what to expect after the C-section at home. It's a 3-tier.
Oh, okay. So antenatally, of course, that's why we emphasize the importance of antenatal care. So we counsel you on why we're doing the CS, the procedure. So we start preparing you early enough. The procedure, how it's gonna be, what like scar you're going to get and things like that, and the type of anesthesia you're going to get. So antenatal care, we prepare you and we tell you why you're undergoing the cesarean section. Now, when you come to hospital, when we finally admit you for the cesarean section, we take consent, which was what I explained earlier. We basically seek your permission for you to undergo the procedure. And we explain again why we're doing the procedure. So we need to ensure that you understand why we're doing the cesarean section, how it's going to be done, expected hospital stay, expected complications and also risks if you don't undergo the procedure. So that's what we do when you get admitted. And we also talk about now the care. So care involves walking around, which she did, so that was not the wrong thing to do. Actually, you're very right to walk around, because walking around encourages blood flow. Remember, you've been pregnant, and being pregnant on its own makes your blood have a higher tendency to clot. So pregnancy and also undergoing any surgery increases your tendency the blood to clot. So we encourage you to walk around as soon as you can, and we give you medications like blood thinners to prevent you from having a clot. Other care is like I was talking about earlier, hygiene, so wound care. So while you're in hospital, your wound is covered, right? But when you're discharged, it's exposed. And when it's exposed, now we have a look at the wound. Before we discharge you home, we have to ensure the wound is okay. So is it bleeding? Is there anything unusual? Is it like opened up, for example? Or is there any discharge from the wound coming out? And if there's any of those things, we don't let you go home. We stay and take care of the wound. All right. Yeah, but if the wound is okay, we encourage the mom to, once we expose the wound, we tell her, like, now you can have a normal shower, like preferably with clean running water. Avoid touching the wound a lot, especially with your bare hands. And we give you antibiotics to take to prevent infection, and also a spray, an antiseptic spray as well, to ensure that the wound doesn't open up. And we also give you, vitamins to encourage wound healing. Like vitamin C is a very good vitamin for wound healing. So yeah, things like that.
All right. I feel like we're already in the aftercare stage of this conversation. Minnie, I shall come to you to talk more on the wound and how you were taking care of it. You mentioned it did open, but basically how you were doing it at home. But there's so many questions, Doc. One here says, I'm Teresia from Machakos. My question is, I'm 3 months post-CS delivery. Can I do exercise to reduce my tummy?
Yes, 3 months, definitely the healing has taken place, both inside and on the outside of the wound. So yeah, you can do exercise, but I'd say be cautious, avoid lifting heavy weights, because it can predispose you to having a hernia, or like just a weakening around the scar. Yeah.
What are the do's and don'ts after ACS?
So walking around is a do. Hygiene, avoiding lifting heavy weights is a don't. Don't lift heavy weights. Not taking your medication as you're supposed to. And we also encourage breastfeeding as much as you can, because if you don't breastfeed, you get breast engorgement and pain, and that can also predispose to other issues like infections and all that on the breast. So we encourage breastfeeding and diet. So ensure that you take high fiber diet, because we need to ensure that your stool is soft. Because if you have hard stool, if you're constipated, that can cause strain and may also affect the wound.
Yeah. All right. So I was waiting for past 10 p.m. because this is the watershed hour. It's 10:15 because I had a question on that bit of do's and don'ts. Intercourse with your partner. Is it encouraged, or I don't know after how long you should wait to have that? And also Alice here from Meru is asking, her first question is what may lead one to undergo CS? We did answer that. But her second question is it advisable to make love with your partner until delivery time?
So after CS, we give you 6 weeks. Yeah. 6 weeks to heal, and you can resume intercourse. Is that what she was asking?
Yeah, that's it. Okay, that's pretty much it. 6 weeks. Yeah. Hi, Doc. I'm Christine. I went through C-section, and the reason as to why I went through it is because my amniotic fluid was 6 centimeters. Is that a good reason?
Maybe she needs to expound more.
I know. Christine, if you are still watching us, just expound on your question, and Doc here will be gracious enough to answer it. Blessed Bella from Bungoma, she says she was taken in for CS due to prolonged labor. It is 7 years now. She has never conceived again. She was an adult in primary. She's now in her early 40s. So she's asking, is there a probability that I may not have another kid?
No.
Because of a CS? No.
A CS does not affect your ability to have another child unless that CS had complications and maybe you bled a lot and you ended up having a hysterectomy or your uterus being removed because of the heavy bleeding to save your life.
All right, okay.
Or maybe infections like severe infections can affect your tubes. Yeah.
All right. And, I love it when the men to ask questions because, granted, this is her say, it's a women's show. But funny enough, I remember we once had a conversation on reproductive health and breastfeeding, and most of the callers were men. So actually, when this happens. And Erastus Mukangai is asking, can a fetus with a short cord predispose a woman to CS? Then how about private or public health institutions? Because we pretty much answered that. So, answer that bit on a fetus with a short cord predisposing a woman to a CS. No. Okay.
A cord around the neck, maybe a long cord, a very long cord can predispose the fetus having it around the neck, and what happens, it strangulates and affects the baby's blood supply and things like that, so that can predispose to a caesarean section.
All right, so Alice, remember the one who was asking about she's asked another question. For one to deliver normally, how many centimeters should one be?
Fully dilated.
10
centimeters.
All right, 10.
Yes.
Okay, fine. So let me put a pause there. We shall get back to that. And I want to engage Minnie here. I did mention that I would ask you about how you are taking care of yourself in terms of the wound at home with available, of course, treatments at home.
Okay, I'll start by asking Daktari a question. You talked about being discharged with an open wound. That didn't happen to me. I was discharged with my wound covered with bandage. Were they wrong? Or
no, they were not wrong. Sometimes it may be okay to take precautions and cover the wound for a bit longer. Well, the average time is 3 days. You may cover it longer and ask you to come maybe on the 5th day and have a look at the wound.
Actually, they told me to come after 2 weeks. I know that's funny. And they asked me to take a full body shower during the first day after my CS. Were they right?
I can't say they were right or wrong.
Because every time I try to imagine what really happened, what made my CS wound open.
Well, like I'd explained earlier, if you've undergone a previous CS or any previous surgery, you go through scar formation and what you call adhesions. And when you form adhesions, it makes the next surgeries more difficult and likely to have complications. So those complications include you're at a higher risk of having infection on the inside and even on the outside, on the wound. You're also at a higher risk of having excessive bleeding. You're at a higher risk of staying in hospital longer. Yeah, so, yeah.
All right.
That's one of the risk factors of having complications in the next surgery and having those, post-operative complications.
All right, thank you.
Now answer mine.
Okay, now to answer you.
It's fine, you're allowed.
I was discharged with antibiotics, so I was like taking ×2 a day, if I can remember well. And for the aftercare, I didn't do much because the wound was covered. So I just took the meds. Yeah.
So in terms of like cleaning, like what Doc here was talking about, you
I couldn't clean because it had a bandage.
Yeah.
Well, even taking antibiotics on its own also prevents infection. So that's still okay.
All right, okay. So I look a bit distracted because there's so many questions. To be honest, I didn't expect this, but there's so many. And from the men, like I said, Milia is asking, I believe we answered this, how many consecutive CSs can one handle? And then, does CS predict how many pregnancies one can handle? Those are pretty much the same questions,
Yeah, I can't tell you don't have a third child, don't have a fourth child, don't have a fifth child. But what I can tell you is the risk associated with having multiple cesarean sections.
Which you did, actually.
Yeah.
I remember that.
Yeah.
Teresia here, who asked whether it's okay to exercise to reduce her tummy. Remember, she's 3 months post-CS delivery. Is asking whether that exercise can now affect milk production. No.
There's no relationship.
Absolutely not. Okay.
Unless she's exercising excessively to the point now it's affecting her hormones. Yeah.
How about for people who used to exercise before pregnancy and during pregnancy? I mean, is there a limit? When you say, don't do it too much, how much is too much?
I can't tell you how much is too much. I mean, exercise in moderation is okay. Yeah. So long as you're not overstretching yourself, lifting heavy weights, overdoing it. Yeah. Exercise is actually recommended once you've healed. Yeah.
Once you've healed.
Yeah.
Okay, I love our viewers because they have so many questions. Alice, again, is asking, why is it that sometimes the delivery date has reached and no labor pains? This is Alice. She says she's enjoying the show and learning.
So, yeah, there's some women who are just predisposed to not having labor start once they reach their due date. And that's what you call postdatism. Yeah, postdatism or, beyond your due date. That's postdatism. Yeah, so some women are predisposed to having postdatism. Others have had to undergo induction of labor. And that happens now in subsequent pregnancies. So if your previous pregnancy you were induced, you're likely to be induced in the next pregnancy and so on. So it just varies. Yeah.
All right. And there's a question that I came across during my research on the cut for the CS. I mean, is the same scar cut for a CS?
Yeah, where the previous scar was, that's the same place we recommend that you go through. However, some factors may affect that. For example, if the extraction is difficult, the baby may be too big for going through that small. So you may have to extend the scar, or you may have to form another scar, which is not, the best, but at the end of the day, you need the baby out, You need the baby to survive, you need the mother to survive. So you have to do what you have to do.
Most definitely.
Yeah, so, but usually we go through the same, where the previous scar was, that's where we go through.
But then again, when you say that's not the best, having another scar, why is that?
Because cosmetically, I mean, it doesn't look very, and also it may predispose you to, well, but not always, infection sometimes, because of just the general care,
All right, okay. There's something else about laughing and sneezing and coughing when you have the stitches. And my research told me to put a pillow over the stitches and press onto oneself. Is that true? I don't know. Google
no, laughing, coughing, I mean, those are normal things. It doesn't increase your pressure so much that it will cause the scar to give way. Yeah.
Okay.
Yeah.
Okay.
Yeah, so no.
All right, that's interesting. Minnie, let me come back to you because you've told us about your first pregnancy and your experience with CS and the second one. But I'm curious on whether your experience with the second pregnancy and the second CS made you, say, fear getting pregnant another time, Minnie.
I think I'm just done.
You are done?
Yeah, I'm just done. I'm not ready to go through that again.
Because of what you experienced?
Yes, especially with the second one. Yeah, the pain, you know, the back pain, you know, it's on another level. It's around 7 years now, but I can still feel the back.
7 years?
Yes, the back pain is too much. And then there's this numbness around my scar. I don't think I'd want to go through that again. So I'm just done with giving birth.
Okay, we hear you, Minnie. And thank you for answering, by the way. That was like an intrusive question, yeah? We have 3 minutes left. Can you believe it?
Wow.
What's her name? Joy is asking whether a placenta grade 2, I honestly don't understand that, but I'm sure you do, whether a placenta grade 2 necessitates a CS.
Well, grade 2 is not... so what happens? So the grading... So what happens with the placenta? The placenta is normally attached on the uterus, and it's usually on the upper part in a normal pregnancy. In some situations, it may end up migrating and move lower. So the closer it is to... So your uterus is like shaped like that, and then the cervix is where now the baby comes out through. So the closer it is to the cervix, or covering the passage of where the baby is supposed to pass, the higher the grade. So it's up to 4. So the closer it is, or even completely covering the passage of the cervix, now that's a high grade, that's grade 4. Yeah. If it's away, maybe like grade 1 or 2, so grade 1 is the farthest, grade 2 is like kind of in the middle, grade 3 is close, and grade 4 is now covering the cervical opening. So grade 1 or 2, it depends. Is she bleeding? Is she not bleeding? Yeah, because it's not covering the passage, so she may deliver normally. But something like grade 3 or 4, it's very close to the cervical os. I mean to the opening, and that for sure she may need a caesarean section.
Right.
Yeah.
Completely out of time, but Alice is asking whether induced labor can cause any complications.
Yes, it may. Induction of labor is now starting labor by medication. And this may cause maybe the woman to undergo a fast labor, which is called precipitate labor. And precipitate labor may predispose to bleeding after delivery. Another possible risk is uterine rupture. Yeah.
All right. Okay. So about 2 minutes left. Nick, or 1? Okay. He will tell me later on, but I need to get your closing 1 minute. That's what he says. Your closing remarks. I'll start with you, Minnie, because you just told us that umefunga chapter. Na mzee anajua.
Hata tulishaelewana.
Tukaongea mkakubaliana. Sasa mtu anakuwatch saizi, mwanamke anakuwatch saizi mwenye probably, you know, has that fear, has made the decision that you have, or went through what you went through with your second CS. What would you tell them?
Not much. At times it happens because there's nothing we can do to just move on and just accept whatever happened and try to heal and get as much support as they can. Yeah.
And not to probably express it on the baby, right?
But you know, sometimes
you can't help.
Yeah, you can't help.
Doing it.
Exactly, you can't help it. At times, it happened with my firstborn. You know, I was in so much pain and he had so much colic. You know, it came to a point I was just leaving him to just cry. At times you don't know when you're doing
That's true, postpartum.
Yes,
comes in.
So I can't really talk about that.
Yeah.
Whatever I can just advise them is to try and get much support and to talk about it. Yeah.
Yes, definitely. And I like that. I love that because sometimes when especially PPD is happening, you actually don't know. It's there, yeah? Doc, your closing remarks. Uterine rupture. Alice, is it Alice? Yeah, hey, Alice, ukona maswali mengi, lakini asante. She says tumuulizie hii swali before we close. What is it?
It's like rupture of the uterus, literally. So the previous scar where it was giving way, or yeah, like it rupturing.
Ruptures,
yes.
basically.
Yes.
Evo too.
Yeah.
Your closing remarks.
So as COGS, we recommend antenatal care and counseling of women who are scheduled for cesarean section, and telling them why they have to undergo the cesarean section, and also talking to them about the procedure and the aftercare. So we recommend that women, and also ask us questions regarding like the signs you see when you go home, things like bleeding, things like severe headaches, things like discharge from the wound. Yeah, so tell us, communicate to us if you experience any of those danger signs, and go to hospital immediately. Yes.
And Doc, I need to be fair to my people, because clearly you need to give them your details, yeah? I don't know what you're comfortable with. One is actually asking for your WhatsApp number. I don't know if you're comfortable with that. But whatever details that you're comfortable, because there's so many questions. Another one asking, apart from breach, what are the factors lead to CS, which we discussed. But I feel like they have so many questions for you. So where do they find you?
So they can reach out to me on Instagram, Dr.Anzeze, that's A-N-Z-E-Z-E, on Instagram, Facebook, and we will get back to them. And also my clinic at Nelson Awori Center, if you wish to have consultation. You're most welcome.
Upper Hill?
Yes, that's in Upper Hill.
All right, okay. So there you have it, yeah? In case so many more questions still coming in, but we're completely out of time, so do reach out to Dr. Angela there, and she shall respond to all of them. Thank you so much, Minnie Mururi, a mother and a digital marketer, and you haven't marketed yourself?
Yes, I'm a digital marketer. I specialize in SEO, so I help businesses become visible on Google. Yes.
All right. Okay.
Yes.
That's what she does.
Good to know.
Yeah. And of course, Dr. Angela Anzeze, an obstetrician gynecologist and a member Kenya Obstetrical and Gynecological Society. Thank you so much, ladies, for your time and your contribution tonight. We do appreciate it. Clearly, it's been insightful. It's been informative, educative. This is how you tell that it has been all the engagement on social media. Thank you for your time and your company and your questions. I do appreciate them on WhatsApp, on Twitter, and all the other social media platforms. Thank you to the entire crew that made this production a success. My name is Grace Kuriakanja. I'll see you again tomorrow for To The Point. Okay, same time, same place. Good night.